Well, hi, I'm Scott Schroeder, and I'm the Executive Director of Care to Communities. And what we do at Care to Communities is we deliver primary health care to communities with significant need throughout northern Haiti. And I've been at the organization about 6 months, but I've been in the nonprofit NGO world for over 10 years. Before Care to Communities, I was working at organizations like Pathfinder and Plan International, running development and communications. So this is it's an industry I've been in for 10 years, but it's obviously wearing a little different hat now as an executive director, overseeing the entire operation. We're just very excited to be part of this partnership and collaboration. And I think at an organization the size of ours, we really feel like we're kind of at that launching pad stage, if you will. We've established a model that we're really excited about, but organizations often struggle taking that next step to go from well-established, viable model, but to truly achieve scale. You need help, right? And so I think an organization like Innovations in Healthcare, with the collaboration opportunities, both meeting peer organizations like ours that are going through some of the same struggles we are, but also opening doors into funding and coaching, mentoring opportunities, all that are exactly the kind of catalysts that we're hoping to get, and as we kind of take that next step in our evolution. We feel like we've got some very powerful ingredients pulled together that really makes us a differentiated offering in a country where there are lots of organizations doing great work. Specifically, those ingredients is, first of all, we've partnered with the Ministry of Health in a true public-private partnership, so that we're not building new clinics from scratch, because in fact, there are plenty of clinics in Haiti, many of them either built by the ministry or acquired by the ministry as a kind of after effect of larger grants and dollars in the past. So the issue is not the availability of a clinic. The issue is the quality and the facilities and the systems inside the clinic itself. So when we partner with the ministry, we upgrade an existing clinic, and we introduce one-stop shop, as we like to call it. So we have a pharmacy under one roof. We have obviously the clinical testing facilities and labs, and we upgrade the equipment significantly as well. So that one-stop shop, and obviously the investment that we put in the physical plant upgrade and introducing some new staff as well, significantly improves the quality of care. We know this because we use this ministry's same measures pre-post from when we take over, and we've lifted it about 40 percentage points on their own measures. And last ingredient we're very excited about is there's a sustainability component to what we do, because we do charge a fee. We charge below market, and that's helped through our philanthropic efforts. But we feel it is important to charge for services. Most healthcare is fee-for-service in Haiti, but we believe that we're bringing it at a significantly higher level of quality and slightly below market rate. And so that we have a path to scale through our partnership with the ministry, and we have, I think, a nice sustainability story with that fee-for-service model. And we're delivering quality with everything we do, and we're certainly seeing that lift. That one-stop shop really helps the patient experience after we've upgraded the facilities. To some degree, it's an answer that's maybe perhaps not all that different than what we hope for in our own country, which is, primary health care and quality primary health care is an issue around the entire globe. And it's certainly not something that's been solved right here in the United States. It's an even greater need in Haiti. So I think we just want to continue to expand the model that we're very excited about. The Ministry of Health is asking us almost weekly, when can we take on more clinics? So certainly an expansion of our model elsewhere in the country is a big part of our goal for the next 5 years. But we think that what we do is replicable elsewhere in the developing world, because the need is certainly consistent. And so through partnerships with other NGOs and some donors who are interested, and potentially expanding to other countries like Haiti with a great need for primary health care of high quality. We think we can be not only a much bigger footprint in Haiti, but potentially in a few other developing countries as well in that 5 to 10 year period. You know, sometimes the needs are actually quite similar in places like Africa and even India. And again, if the catalyst were a donor who's interested in India or interested in a certain part of Africa and was interested in taking our expertise to that country, you know, another big catalyst is organizations of our size often begin to partner with larger NGOs. And so we can sort of subcontract in a way certain pieces of a larger grant. So that's also a very frequent opening into other countries where, you know, larger NGOs may operate and would ask us to go and help them in you know, whether it's Africa, elsewhere in Latin America, et cetera. Just very excited to be here, and you know, I think that we think that this is something we'll benefit from a great deal. But I hope that, you know, other new members of the innovations in healthcare cohort that's joining this well, today and this year, you know, hopefully they can benefit from things that we've learned on the ground, and it's a true collaborative partnership in both directions.